COVID is making a comeback. Cases of a new Omicron subvariant called JN.1 are rising worldwide. Now, in the wake of surge, World Health Organization has urged the nations to continue with the measures to curb the virus. We have been telling about the rise of cases in India. 127 fresh cases of the new variant have been reported across the country, with 111 and 1 reported dead from Kerala. 15 cases of the new JN.1 subvariant have also been detected in Goa. The central government has issued a vigilance advisory to all states. Karnataka has now made masks mandatory for all citizens above the age of 60. Among the several nations witnessing the rise, Singapore has recorded 56,000 more COVID cases in last week up to December 9th. Cases have risen from 32,035 in the previous week. The vast majority of cases are infected by this new variant. This has prompted the Health Ministry to issue an advisory for citizens and travellers. In Europe, UK is now preparing for a potentially devastating wave. Experts have warned that the new wave here could be one of the worst since vaccines were created. Cases are spreading as Brits' immunity levels are waning. Almost 6,000 people have tested positive throughout England in the past week. Now, this marks over 38% rise compared to the previous week. Moving on to Germany now. Here too, infections have reached at the highest levels since June of 2022. The subvariant is reportedly responsible for almost a third of the cases, while the risk to the general population has been deemed low. Health Minister has urged people to get the vaccinations topped up. In the United States, 17 states have reported high or very high levels of respiratory illness activity as COVID-19 and other flu hospitalizations increased. COVID-19 hospitalizations rose to 23,432. Now, this according to the data published up to December 9th, that is. An alert has been issued to healthcare providers, encouraging them to administer COVID-19 and flu vaccines as soon as possible. Meanwhile, China has detected 7 cases of contracted the subvariant JN.1 in about a month. The infections in China are at a low epidemic level as per the health authorities. However, experts have warned that more cases of the variant are expected. The JN.1 subvariant is a descendant of the BA.2.86 variant of COVID, commonly referred to as spirola. Symptoms of an infection include fever, nasal discharge, throat infections, migraines, and mild gastrointestinal issues.